Hi, this is Sally Flashberger with the Wisconsin Board for People with Developmental Disabilities. It's been a little time since we've been here presenting, so we're excited to be back talking about the COVID-19 vaccine. And we are also joined by some community partners who are working on vaccination for people with disabilities. So we're going to have a lot of great information today. And we, as always, we thank our speakers for joining us, and I'll let them introduce themselves as we get started. If you have any questions, you can post them in the chat if you're on our Zoom, but if you're on Facebook, just put them in the comments and we will be monitoring for any questions that you might have. So with that, I'm going to turn it over to Marsha, our great nurse who has joined us so many times. She's going to talk about updates to the COVID-19 vaccine. Take it away, Marsha.
Good morning. Well, mostly good news that I want to discuss with you. There's vaccine readily available, and I think we're going to hear more about that from all the different groups following me. But the long and short of it is get vaccinated. Millions and millions and millions of people have been vaccinated, and there's been minuscule number of people who've had any kind of significant side effects other than what you would expect when you have an immune response, and those pass quickly. So we've talked about this before. When you have your vaccination, you might have a little fever, a little achiness, feeling just a little punk for up to 2 days at the most. Most people, it's less than that. And your arm might be sore. That's typical for any vaccination. But again, it's well worth it. Once you've been vaccinated, plus 2 weeks after your final shot, if you've had the 2 shots or the 1 shot with J&J, you then can resume normal activities. And that's a wonderful, wonderful privilege that we should not take for granted. You can be out without a mask. You can be in without a mask. You do have to follow rules for places that may still require a mask. You will need to be masked in a clinical setting, a hospital, anything like that. You will need to be masked on any public transportation. But that's it. So it is well worth it to get vaccinated if you haven't been vaccinated yet. Most of people in Wisconsin who are adults, the majority of adults, have been vaccinated, but it is spotty. There are some counties that are still high risk simply because people have not gotten vaccinated. And other counties where there's extremely low risk. I saw the data for today in Dane County, for instance. As of yesterday, 0 hospitalizations, 0 deaths, and only 7 people in the whole county that had COVID-19. So there's a big difference where people have been willing and able to get their vaccinations, and in some counties where that hasn't been the case. However, the other really super good news is what 50% of all of the population of Wisconsin has had at least 1 shot. And so that is including everybody from infancy up. And we know only people 12 years and older are approved at this point to have the vaccination. So that is all super good news. Another just very recent release in the New York Times, there has been a study where they've been checking people, those people who've had vaccinations over time, like 6-8 months. They've been checking them for their antibodies, and more than that, for their long-term memory cell response to the vaccines. And to their surprise, they're finding for both Pfizer and Moderna that people are continuing to develop more immunity as time goes on. So this is giving people a huge cheer of possibility for not even needing a booster, which has kind of been lurking, thinking, yes, that's probably what we're going to need. But at this point, there's hope that we won't even need a booster shot. So we'll just have to see. That is just the first study. It was a smaller group, so we're going to have to keep our eyes on what's happening, what's going on. There also has been no variant so far that has been resistant to the vaccinations. In other words, the vaccinations work. You're seeing a lot in the media about the Delta variant of the COVID-19. And yes, it is more contagious. Yes, people have been getting sicker. Yes, it has been affecting young adults more. All of those things are true. Right now, there's not very much of it in Wisconsin. Estimated maybe 10% of the COVID-19 in Wisconsin is Delta right now. But because it is so contagious, it is likely that by fall, the variant that is in Wisconsin the predominant one will be the Delta. What that means for you if you've had a shot or two and you don't need to worry. You are okay. However, it is definitely a concern for people who are unwilling or unable to get vaccinated. And so that really is, I think, why it's getting as much publicity as it is, because there are such pockets of places in the United States where people have not gotten vaccinated. And internationally, it's really hitting people hard. And you probably were very aware of what had happened in India, still happening there, maybe not quite as dramatically. And in other places, even in England, they now are struggling with the Delta variant. So once again, they're dealing with it. They've been doing well getting vaccinated. So that's the international story. I wouldn't recommend going. Traveling overseas, I'm not sure that any of you are planning to do that anyway, but traveling within the United States, you're okay. I think you've got to wear a mask. So there's no use getting in a fight on an airplane like we've seen some people have been doing. The other thing that's been happening is people are getting colds. People are getting viruses that they haven't been getting for over a year because they've been isolated, they've been wearing masks, whatever. So people certainly may get a cold, they may start coughing, they may sneeze and feel punk. And then there's the worry. Is it COVID-19? Well, it's very unlikely to be COVID-19 if you've had your vaccinations. If you want to be tested, you certainly can. You can still get a COVID-19 test through your doctor. There is one that you can order online, but you then need to have a Zoom connection with a healthcare professional when you collect your saliva for it. And that one has to go by UPS back. So it doesn't seem as convenient as I'd hoped it would be. But really, it's readily available still. If you have a question, do I have COVID-19? Get tested. Most likely you won't. If you've been vaccinated, most likely it's not going to be COVID-19. It's not impossible though. But if you have a question, go ahead and get tested. There's one other group that I want to emphasize that should be very careful, and that's for anybody who has immunity problems, immunity compromised. That's often how it's described. That's for people who have had like a kidney transplant, for an example, and are on special medications to prevent rejection. Maybe people who are on chemo for cancer treatment. You would know, or you should talk to your doctor if you have any question on your immunity status. If you think you might not have a strong immune system, then you should still be definitely getting the vaccination, but the vaccination may not be as effective as you would expect it to be. And for that reason, I want to be sure that everybody is aware of that. that they talk about it with their healthcare professionals, because for people who are in that status, they are still going to need to wear masks and follow all of the rules of things that we did before to keep us safe. So, and if you see somebody wearing a mask, maybe they're just being careful, but maybe they have a reason, like they have a compromised immune system. And so we want to be respectful of that. It's, they can have a test, you can have antibody testing that's different than a COVID-19 test. And so if you are wondering about that, talk to your doctor and see about what you should be doing. We want to be mindful and careful, but also hopeful, because I hope all of you have been vaccinated and that now you're feeling free. I've been zipping in and out and around, going to the grocery store, whatever, and no mask. That's grand. So any questions, any concerns, anything I should have brought up that I haven't? Sally?
Sally, we can't hear you.
Was for under 12. Do we have any update when that might be happening?
They are continuing their testing.
Okay.
Yeah, so they haven't finished phase 3 yet.
Yeah, okay. Well, then we'll look forward to maybe having an update when we hear more about that for the under 12. So
yeah,
we definitely have families and, who have kids with disabilities who are probably still looking forward to that. Mm-hmm. All right. Thank you, Marcia. We really appreciate it. I'm going to turn it over to Carla from Inclusa. She's going to tell us about what they are working on in their community project.
Great. Thank you, Sally. We are very grateful to be here. Thank you to Wisconsin BPDD for inviting us to share what we're doing with our COVID-19 vaccination efforts in our communities. My name is Carla Lundeen. I am a quality manager and nurse. I work for Inclusa. I'm also the grant coordinator for this DHS grant we received. So we were very grateful to be one of the recipients of this grant. This has allowed us to provide outreach, education, and support to people beyond the members in our program, and more broadly support the communities that we live in Wisconsin. It gives us a chance to pursue common unity, which is the belief in the strengths of everyone and the commitment to support the common good for all. We really take that to heart. For those of you that might not know who Inclusa is, we are a managed care organization contracted with the state of Wisconsin to implement the family care program. We currently serve just about 15,000 members in 68 counties in Wisconsin. So at Inclusa, we applied for this grant because we hope to create and facilitate local programs of really customized education regarding COVID-19 vaccines, and then develop a program to reduce transportation barriers for people to be vaccinated for COVID-19. So why did we choose these initiatives? Well, as we examined the problem and thought about what we wanted to do, what barriers were out there, we did some research, and most importantly, I think we reached out to some key informants in the communities where where people live and where people are wanting to get vaccinated. We wanted to make sure we were addressing the right issues. So I just want to share a few lessons that we learned through that research, and again, why we picked the route that we went. So first, we learned that accessing reliable transportation is a barrier for many reasons and for many people. For some people, it's cost. For others, it's lack of resources in the community where they live. And in still other cases, it's a lack of the resources might be there, but they don't know how to, they don't have an understanding of how to access those available resources. We also learned that mistrust and fear could be a factor. Several key informants shared with us that this lack of trust has been a major factor in the past with other vaccines and other medical care, and it could lead to increased vaccine hesitancy for COVID-19. And we learned from these key informants too that medical care even today is not as equitable, for example, for people of color or other minority groups. Actual and perceived discrimination was also cited as a factor that might limit some vaccination. So some of those key informants, again, they noted that in the Asian community in particular, some folks might distance themselves from even discussing the coronavirus and COVID-19 because there was that mischaracterization of the origin of the virus and the origins of the coronavirus. There can be some limits to language. In the Hmong language, for example, we learned that certain words for certain medical issues just don't exist, and that words like social distancing don't really translate well. And often pictorial resources like pictorial representations or resources in oral education are often more effective. And then finally, at the time, I think it's changed as we've gone on, but at the time we found a lack of plain language resources. And I know Wisconsin BPDD has been great about also creating and bringing forth some of those. So key informants from all groups shared that while some resources in various languages existed, many were written at a reading level that was that exceeds, what many individuals could use. So, as I stated earlier, this led us to a focus to enhancing the local community impact, developing more plain language resources, and then reducing or eliminating those transportation barriers. So, we wanted to offer some sub-awards to other community groups, maybe that didn't have the opportunity or the ability to apply for the larger DHS grant. So we, because we wanted to facilitate local connections and actions closest to the communities where the populations that we wanted to reach. So these were community groups that were ingrained in the community. They were trusted messengers. So that was one of our interventions that we're moving forward with. Another one was, again, around the plain language resources. We wanted to get some at a, that 4th to 6th grade reading level. I know that even helps me as I'm, especially when it's something new or I'm learning about a complex topic. It helps for me, even as a nurse, to first read about it in simple language, and then I can move on. So I think for a lot of people, that's very, very helpful. So we started leading activities and supporting those local key partners to coordinate the development, translation, printing, and distribution of culturally relevant plain language resources. And then finally, back to transportation. We wanted to be sure that if somebody couldn't get a ride, that wasn't going to be a barrier for them to get vaccinated if they chose to do so. Because that is such a vital part of the vaccination process. If someone wishes to be vaccinated, we wanted to make sure that they could do that. So that was our plan. What have we been doing since we got the grant? Well, first I'll talk about the sub-award plan. It was a really exciting process. We created a process for those community groups and organizations to apply and receive sub-awards. We evaluated 39 sub-award applications, and we were able to award 18 sub-awards to 18 different organizations across the state. These were, again, these organizations that are closely connected to their communities, and they serve as trusted messengers. We distributed sub-awards to groups in Appleton, Milwaukee, Stevens Point, Holman, Shell Lake, Grantsburg, Hudson, Chippewa Falls, Mount Horeb, Glenwood City, Eau Claire, Sparta, Hillsborough, Ashland, and Marshfield. So as you can tell, we kind of took what we were awarded and tried to spread it across the state for other groups and other people that really were doing some innovative and really inclusive things. So again, with these sub-awards, these groups have been doing some great work, undertaking various activities to educate their communities on COVID-19 vaccines. And again, looking at other things to reduce barriers. We are currently in the process of collecting data and information from those groups. We want to learn about what they've been doing and the details of their accomplishments, who they've reached with their efforts, how many folks they've touched. And then we are there to provide guidance and support as needed. So if they have questions, they can reach back out to us. Kind of hand in hand with that were the educational resources. So to assist the sub-award recipients in their efforts, we developed and packaged an evidence-based resource guide of COVID-19 vaccine education for those sub-awardees to use. Of course, if they had another resource that again was evidence-based and really was providing good information. They were free to use that, but for those groups that didn't, we wanted to provide something that was readily accessible to them. And I believe Sally might be throwing a link to that document either now or later in the chat, because we want to share it with everyone. And I really have to credit Wisconsin Department of Health Services. They pulled a lot of these resources together for us in an easy, digestible format as well. And then we were able to build on top of that. So additionally, as part of that larger project aimed at creating more of those effective plain language resources, public health and nursing professionals at Inclusa designed those vaccine resources in plain language. They were easy to read, easy to understand. We had people, review them and make sure that we were on the right track. Several of those are also in process right now for translation into Spanish, and we'll make them available to sub-awardees and others as needed or requested. And then finally, transportation. That's the other pillar of what we were working on. At Inclusa, one of our strengths is that we have developed relationships and we contract with many transportation providers across the state who provide excellent service to customers. Because this was one of our strengths and we identified that getting to the actual vaccine appointments might be a barrier for some, we wanted to do our part to help eliminate that barrier. So we chose to focus on efforts in 5 counties that are in Inclusa service region. Those counties are Ashland, Clark, Forest, Monroe, and Rock County. As we evaluated population-specific needs across all the communities that Inclusa serves, we reviewed one resource from the Centers for Disease Control called the Social Vulnerability Index. It was a great resource that helped us make some decisions about where we wanted to focus our efforts. So at Inclusa, we recognize that each community we serve is unique and has unique factors, unique people, just like every person is unique, the communities that they live in are also unique. So using this social vulnerability index and other factors such as local capacity, local resources for transportation, we identified those 5 counties, those specific regions, as areas that might benefit from more support to avoid risk and to then hopefully recover more quickly from the COVID-19 pandemic, just as Marcia was talking about earlier, kind of that hope side of things. So then we outreached to our transportation providers in those counties, and 5 transportation providers stepped up and were selected. They agreed to subcontract with us to provide transportation as a part of this grant. So transportation for anybody in those counties. They didn't have to be in our program. They just had to say they wanted a ride. That's really the only criteria. And that it was to a vaccination appointment. So we collaborated internally to develop a separate mechanism. Sorry for my dog, she has something to say too. We collaborated internally to develop a separate mechanism for the transportation referral intake from those community partners. And then we developed a process to kind of manage those referrals because it's different from our standard process. We had to keep things separate. And then finally, most importantly, for our transportation providers, we had to develop a separate mechanism to pay them. So that's been working really, really well. And next we had a team within our organization who reached out to community partners like health departments, clinics, other vaccinators in those 5 counties, and also to 211. And we provided information on how folks could access those free rides if they needed to get a vaccine appointment. So that's kind of where we've been at. I will say, as we have learned all too well over the last year and a half, things change. I don't think there's any bigger lesson that I think I've learned, that things can change and they change kind of fast. We found we needed to adjust and we wanted to pivot a little bit based on our ongoing assessment of the COVID-19 vaccine situation. We are finding that transportation needs, though important, might be less of a barrier than first identified. And we want to be good stewards of that grant money and the grant opportunity we were given. We figure this may be due in part to other great resources like the Uber and Lyft programs and other resources throughout the state. There's some really great transportation opportunities out there now, which is awesome. So we reassessed the needs of our communities and we modified our plan just a little bit. So we are refocusing our educational efforts on educational efforts and collaboration with local public health departments and other vaccinators in those 5 counties. And counties that border those 5 counties as well, because those county lines really don't mean a whole lot. People travel back and forth. So we continue to offer free transportation in those counties as well, though. So as a part of this revised approach, for example, we are planning with Monroe County Public Health for rural vaccine clinics and specialized education, promotion, and outreach to rural and Latinx communities in particular in the Monroe County area. We hope to have multiple clinics in July to meet the needs for education and access, including transportation to those COVID-19 vaccines. Also in Wood, Marathon, Clark, and Taylor counties, we are working with a local community contact who is a trusted messenger in that area in the Latinx community as well. We're hoping to reach local farm workers whose primary language is Spanish to educate on COVID-19, how to get a COVID-19 vaccine, what's really required to get a COVID-19 vaccine, and ensure they have the opportunity to get vaccinated if they choose to do so. Finally, we are also currently evaluating how we might outreach in Rock County and Monroe County in those communities as part of their county fairs in July. We want to see if there's some opportunities for us to support the COVID-19 vaccination efforts at those county fairs. So that work's kind of in progress yet. We're not sure exactly, where we're going to head with that. So, well, thank you for giving Inclusa the opportunity to share in this Living Well Wednesday. Thank you, Wisconsin BPDD, for inviting us. And also, I would really like to express our gratitude for all that your organization is doing to support COVID-19 vaccine education and access and learning across Wisconsin. So thank you.
Excellent, thank you. I did see there was a question about which counties you're providing transportation, and I wondered if you have that on your website. We did put the link there to the page, and I know you have COVID resources there, so I wondered if that was the best place for people to look for that.
I don't know if that's the best place. I will throw those counties in the chat again.
Okay, that would be great.
As well as my email, so people can reach out to me directly.
Okay,
So,
and if someone is using Inclusa services and they are looking for a vaccination, they can always talk to their care manager, right? And say, hey, I heard all this information. It was a lot. Where can I go? So I think that's always their best, one of those first steps, right? Is to maybe talk to their care manager and find out. Okay.
Absolutely. For members of Inclusa or any other family care manager, like Lakeland,
right.
Choice Care Wisconsin, talk to your care manager or your nurse. They'll be able to get you set up with transportation if you need it or help you navigate that. The grant money we received is explicitly for people not in our program.
Sure. So, okay.
I mean, we can certainly use the resources, and we have
right.
those with our teams, but really it is about, talk to your team. They're going to be your best resource.
And then before we move on to love, there was a question in the chat about under 12. Marcia, I don't know if you saw that. If not,
yes, I did. Yeah.
Okay. Do you want to maybe answer that? Okay.
Sure. I would say that there doesn't need to be continued masking and social distancing if the rest of the family is already vaccinated. And children in general have always been very low risk as far as getting very sick with COVID-19 and even getting COVID-19. With all the variants we've had predominant in our state so far. So I think that as long as the family feels comfortable with the risk, and I mean that's always where it comes down to is what the parents think. But if it was my child or my grandchild, I would go ahead and resume normal activities. Obviously, if you were around someone or you knew someone was sick, I would certainly avoid that kind of situation. But in general, I think there's always going to be risks in life. And one article I read said, children's risk of COVID-19 and the situation that was described in this question is no more than them riding their bike or playing soccer or whatever. There's always risks in life for children as well as adults. And so the risk for children when in the situation described is relatively small for them to resume normal activities.
Excellent. And again, always talk to your doctor, right?
That's right.
All right. I am going to turn it over to Love. Love. Stephanie's joining us, but we are joined by several of their community partners that are working on vaccination. So I'll turn.
Thanks, Sally. Yes, hi, I'm Stephanie Prin, and I'm the director of Love Inc. And also with me today from Padres y Conexión is Sol and Erica. And then Alejandra Espejo from Love Inc. is here as well. And I'm going to turn it over first to Sol and Erica, if you're able to unmute and share a little bit about the work you all have been doing on vaccine outreach.
Hello, we are Sol and Erica from Padres y Hijos en Acción. And what we are doing right now is that we are focusing on Latino people, and we're trying to share with them like the easy way to get vaccinated, like trying to help personally every people if they have difficulties with getting maybe an appointment, or they sometimes don't know where should they go, or they are not familiar with technologies. So we are trying to provide personal information so they don't have anything that stop them to get safe, them and their families also. We are working in grocery stores, and we post this kind of flyer. We have all the vaccinations places and specifications, like you don't need to have an ID or appointment. You can walk in, because sometimes with their job schedules, it's difficult for them. So we find that this is the easiest way they can have the information easily. And we are also going to the apartments that high populations of Latino people, so they can have this information as well as in their apartments. So that's most of the part. That's mostly, I'm sorry about my English.
It's perfect.
Well, that was excellent. That was excellent.
Thank you, Sol.
And I think,
Thank you.
So you do go door to door trying to encourage people to get a vaccination.
Yeah, that's what we are trying to do, and to have in-person conversations with them, just to like make sure they don't have any doubts, or if they have, that we can give them the right information so they can feel safe to go and get vaccinated.
Thank you.
Excellent. Thank you.
Thank you so much.
And this is in Dane County that this effort is focused, just so we're talking about the same area.
In Dane County, and we target specifically places where has a high Latino population.
All right, thank you. And alongside that work, Love Inc. has been in contact with Public Health Madison-Dane County to see if, in addition to connecting people to these vaccination opportunities, like Sol and Erica are doing, if there's a way to have some pop-up clinics in neighborhoods that we know there's a high Latino population, so we can also maybe create a kind of a fun environment and have a draw for people to come out and get vaccinated. So Andra, I don't know if you want to talk about the event that we have coming up week after next at the fire station downtown.
Yeah, the next mobile clinic will be July 11th. The plans right now will be 9 to 1. And this is Sunday. This is in downtown. But we talked with the priest of the Holy Redeemer and then attended about 500 people weekly. And then we try to reach the people that don't have the vaccine yet. And yeah, we share the page that sold give it to us with the family that they need immediately attended for the vaccine.
Thanks, Alejandra. And there's definitely, I think, some conversation happening around our community about is having a clinic helpful, or is it more helpful to do what Sol and Erica are doing, going door to door and just talking to people? And at this point, we're willing to try anything, and public health has been a really good partner. And there's a group of individuals that public health gathered last week that we met with to talk about what's working in different communities of color around the Madison area. So we will get you guys the information that we have about that July 11th event. It's going to be near Holy Redeemer Church in downtown Madison at Fire Station number 1, I believe it is. So if you know anybody.
Yeah, if I can say also, Stephanie, that Holy Redeemer and St. Patrick, they are different buildings, but Holy Redeemer have more, they attended also Anglo people and St. Patrick, and our plan is try to get both communities.
Thanks, Alejandra. Sally, did you also want me to talk about the efforts with the tribal?
Yeah, that would be great.
Families.
Mm-hmm.
Okay.
I did just have one question. If you're seeing one working better than the other, the at home or the clinics, if there's been a difference or.
So the July 11th mobile clinic is our first. So I don't know that we could say for sure. I think what I heard from other folks that are doing this work at the meeting I mentioned last week with public health, it sounds like if you're going to do a mobile clinic, to make sure that you are going to a location where there's already going to be people gathered, so that you're drawing from that. We're also going to bring incentives to folks who are coming and getting vaccinated. We've worked with FEMA to make sure that we can offer some food to people who come and that kind of stuff. So that's what we're hoping for. We'll see how it goes. If it seems like it's a good turnout, we are in conversation with public health to do another mobile clinic, 2 more mobile clinics, one in Fitchburg and one up on the north side of Madison, where there is a real, both if you look at statistics that the public health has about who's getting vaccinated, and then also if you look at vaccine locations, there's kind of a desert on the north side of Madison where people aren't getting vaccinated. It's high Latino population, and the closest vaccine clinic is some miles away from this neighborhood. So that's something that we're looking at for the future if this goes well. And then additionally, Love Inc. is partnering with Ho-Chunk Nation to do some work with them around encouraging their youth to get vaccinated. So the tribal nations in Wisconsin, for the most part, have done a really excellent job of getting their elders vaccinated, but tribal youth have a much lower rate of vaccination. And so we are collaborating specifically with Ho-Chunk Nation to think about some creative ways to do some social media campaigns and other promotion of the vaccine for young people. So that's what I can share about that.
Yeah, I think we're seeing that not just in, tribal youth, but youth all over the country. So I think that strategy is good, and glad you guys are getting on that right away. I don't see any questions. I don't see any questions, and I do see they posted the link, I think, to the event. So I can see a link in there. I'm just not going to pop it open in the middle. All right. Troy from Opportunity, you're up next. And I think Caitlin has the video. So just let us know how you want us to, when you want us to show the video.
Sure, sure. Well, thanks for having me, and thanks to BPDD. And my name is Troy Norman. I am the COVID-19 navigator is my title, so one of many. And I've been with Opportunities, Inc. for about a year. Prior to that, I worked for Goodwill Industries of Southeastern Wisconsin for about 30 years. So with regard to our grant, I'll kind of focus in on kind of some of the things that we've been doing in terms of outreach and education. I've got a little video that we'll show shortly that kind of speaks to that, and how we're getting information out to individuals. You know, our focus has really been on South Central Wisconsin, Southeast Wisconsin, reaching out to individuals who may have limited access to different resources on COVID. And so we built a wonderful kit. I understand Barb and Robin have talked to many of you about it. We call it our welcome kit. It's really an outstanding informational kit. It talks, and the focus is really around educating individuals, encouraging them to go out, you know, and find the vaccine, and then telling them where the vaccine is available to them within their community. We have also gone so far as to have a clinic in Jefferson County available to individuals, and worked to make sure people had access to that clinic. The approach that I used when we were starting out, and the rest of our group, was to look at our existing community partners that we had, but going out and talking to individuals, kind of meeting them where they're at. So I went out to different meal programs in our community, went to talk to NAMI. It was interesting times, because not everybody necessarily wanted to talk to you, but I wanted to get out there in the community and find out what resources were out there, and what was lacking, and how we could help improve that situation. So that's what I did. And so now we've got some regular sessions where I'll go to the meal program and I'll do a presentation with individuals, make them aware of, COVID-19 if they're not, where they can go and get their free vaccine. So I think that's really worked very effectively. We kind of found out that other people need other resources, as we know, and many of them are looking for work. So not only can I go out there and talk to them about, where to get your vaccine, but I can also give them resources on, different job opportunities that exist in the community, and connect them with those resources. So we're doing that at places like job centers, also partnering with housing organizations, people who are dealing with homelessness, pantries, and they've been wonderful partners. They've been distributing the information out when people come for their meals, or if they're delivering meals, things of that nature. At James Place, which is an organization in Waukesha through Elmbrook Church that reaches out and helps individuals in the community. We've been holding a regular weekly meeting where people can come. I can talk to them about COVID, and then they can also get some housing resources from me, some transportation resources, and some employment resources. So I think overall it's gone extremely well. our marketing department has done an excellent job of creating a quick resource that connects you to a Google Drive. So lots of people have phones these days. And so it gives you good, current, straightforward information. And on that Google Drive, you'll find a series of videos. We felt that that was probably the easiest way to communicate information on COVID. And it also, then the QRs will connect you to the different vaccine sites within the community. So I think it's gone extremely well. And I don't know if anybody would have any questions. Some of the other groups we've reached out to is like Goodwill in southeastern Wisconsin, obviously having worked there before, and they distributed out to their network. So I'm just impressed by the cooperation and the willingness of the community partners, and people have been very open to information on COVID and come back and, thanked me. And I said, well, you're the one who did it. You just took the information and you followed through and got your vaccine. So I'm glad to hear that. And, I think ultimately with this information, this allows people to get back to, more independent lives or back to work and other things. So hopefully that's helpful. And I have a little video, Sally, if you want to play that. I think
that's great. And I'll link the COVID-19 resource page too. I'll put that in the chat for everyone. So you'll have that. But yeah, go ahead. Caitlin, I think is going to tee up the video because you guys have made some great videos. So.
Yeah, thanks. I appreciate it. They did a nice job.
Hi, I'm Laura Lloyd, and welcome to the COVID Vaccine Community Outreach Project video series, where we will focus on education, encouragement, and empowerment to advance health equity across Wisconsin. What are you waiting for? Educate yourself on the COVID vaccine. It is safe and effective. There are minimal side effects, and you build your immunity in only 2 weeks.
A lot of vaccines in the past, I never had any side effects, so.
It was very quick and easy.
I think it's better to be safe than sorry. I know what it is to not have it.
Encourage yourself to get the COVID vaccine. It will build your resistance against COVID-19. You can boost protection for yourself and others. Plus, you'll be part of creating a safer community.
I have a mom who has COPD. Definitely would hate to bring any sort of issues to my family.
I've never been big on vaccines. I think because of the severity and having lost a brother to it and an aunt and a cousin kind of made it more personal. It's just a must.
Empower yourself to get the COVID vaccine. The vaccine is open for all adults and many younger age groups. Free vaccination. Map of vaccine locations is available online or call 844-684-1064 for vaccine locations.
It was easy. I was already here and I didn't have to travel anywhere. It was very convenient.
This is close to my job too.
So I'm just excited for a better 2021.
Education, encouragement, and empowerment for yourself to get back to work, leisure, and life. What are you waiting for? Your time is now. For more information, contact our COVID Navigator at 1-800-314-4567, extension 4044. Thank you for doing your part to keep our community safe.
Well, thanks, Sally. I appreciate you playing the video. And yeah, I think things have gone very well. We've reached a lot of people and we're encouraged and, starting to have, an expansion of, health equity across the state, I think is is important. So getting that in.
Yes, this has brought up a lot of conversation around that, I think.
Yeah.
Really thinking about that. So thank you so much. We really appreciate you joining us, and your videos are always good. I love the videos.
I'll let them.
Yeah. All right. I'm going to turn it over to Caitlin and Sarah, and they're going to talk about what BPDD is doing, because we're trying to help people get some vaccinations also.
Yeah, I'll just quickly talk about our own community outreach grants that are starting up, and then I'll let Sarah talk about our helpline. So BPDD has just finished granting some vaccination outreach grants to community partners. We're going to be announcing those. We just contacted the recipients, so we're going to be announcing those pretty soon. They're going to work with communities across the state of Wisconsin. It was a nice geographical spread of places, focusing on underserved and diverse populations who, again, it goes back to that health equity thing, making sure that these community groups have the resources they need to get people vaccinated. Some of them will be hosting vaccination clinics. Some will be doing more outreach, hosting conversations and getting more information to vaccine hesitant groups. So we're really excited about that, and we'll hopefully get to do a Living Well Wednesday or something like that, where we get to talk to them about what they're seeing. Those grants will run through the end of the year. So a lot of them are focused on the late summer, but they are potentially running all the way through the end of the year, so that we can continue this effort to get the rest of Wisconsin vaccinated. And then I'll let Sarah talk just quickly about our own helpline.
Yes, so Sarah, introduce yourself, because you're new to Living Well Wednesday as a BPDD member. So
absolutely. Hi, I'm Sierra. I'm BPDD's summer intern office associate, and I'm also, I guess, our own vaccine navigator in a way, because we are doing a vaccine helpline at our office number, and I'm operating it remotely Monday through Friday, 10 to 4, and we're helping anyone who calls in find and set up a vaccine appointment, answer any questions they have, ease any doubts or hesitancy, and also finding transportation. So identifying those barriers and overcoming them for anybody with a disability or anyone in general, I guess, to get that COVID vaccine.
And we plan to run that through the summer, and then we'll see where we go from there. But this has been a new undertaking for us, because we don't do a lot of direct service. So it's been exciting to have Sierra join us and help us learn how to do this kind of work. And so Sierra is also answering other calls that are coming in. So you may, if you're calling BPDD for something else, you also may interact with Sierra, because everything is going her way this summer. So, but it's been very exciting. So I don't see any additional questions. Just looking, we put a lot of resources in the chat, and I think Caitlin probably got most of those up on our Facebook page. We are not sure when the next Living Well Wednesday is, but we'll send you out a notice. If you want to share this video, it'll be up on our Facebook page. Thank you so much to all the community partners that joined us, and to Marsha. It's always great to come back together and talk about what everyone is doing. And I just it's just amazing how many people we probably are reaching by these efforts. And, let's just keep working so we can get back to whatever new normal might be. So thank you very much. We really appreciate it. I'm gonna stop some of our things here.